Hello and welcome to our final edition of our podcast honouring Black History Month. And today we are incredibly honoured to be joined by Clarence Chikusu, who I like to refer to as a man of many roles. He is a consultant physician, director of clinical education, interim senior adult medical services lead, as well as our armed forces clinical lead. The work that Clarence does in our organisation has an absolutely massive impact, and we're incredibly grateful to you, Clarence, for joining us today. To start us off with, can you tell us a little about your cultural history?
In Zambia in the sort of late 70s, the British government were giving a lot of these scholarships around as part of the rebuild of infrastructure and developing professionals after Zambia getting independence in 1964. So went back to Zambia after he did his PhD, and he got a job, and I sort of grew up with my two sisters for the early years in Zambia. At that point, my father made a decision about the way the education system was going in Zambia in sort of public schools, and felt that I needed a private education to better my chances in life at that time. And that's how I ended up in the UK at boarding school. I was very lucky to have two parents who valued education and put that at the forefront of our sort of development as kids as a means to getting on in life. And my grandparents, both sides, had similar sort of values as well. And so that kind of made education already something embedded in me from a very young age.
That definitely sounds like that has influenced why you are now our Director of Clinical Education. It also sounds like, I'm not sure if you're aware, but this year's theme for Black History Month is Standing Firm in Power and Pride. And I feel like with you talking about, the values that your family are holding and the importance of education, that your family has been standing firm in power and pride for forever. And what does that mean to you, though?
I like the theme of this month, and there are times where life can be quite tricky, and you have to dig deep and find something within yourself to stand firm and have that pride. I call it my locker room, where I can retreat back, open it up, and then find something in there that absolutely is the thing I can just put on a shield, or I can pull out a sword, whatever it might be, that just allows me to get back into the game for me. And so that's really important. The basis of that for myself does come from having also listened to what it was like for my grandparents in colonial Africa, what it was like for my parents as children growing up in colonial Africa, and then other aspects of just getting through life. Mine was tested when I sort of left Zambia at age 12 to come to boarding school. I was on my own, and my parents returned back to Zambia and sort of left me there. Wasn't altogether a bad thing. It worked okay. But again, there were times when I had nobody, where, as a child growing up in a boarding school, there are times where you have to develop a way of coping with certain things. Loneliness can be one of those, and just simply missing your parents. And so again, you pick up a pattern in your own self of how to stand firm, how to be confident, how to have pride. And the pride bit is really important to me, because I saw a dignity in my grandfather's and my grandmother's calm reassurance that everything is okay. And I think that also is something I've picked up on in my own personality, and that's what it means to me.
It's an honour to hear about, your family, and it's the kind of conversations you don't really have at work. You don't take that moment to stop and appreciate the person that's behind, the roles that we see at, the kind of first level when we talk to each other at work. So to hear you talk about all of that is just so wonderful, and I'm just really grateful to you today for being able to do that. What has your career path, your current role looked like?
It was almost a straightforward decision to do medicine. That's not quite true. During my A-levels, I wanted to be a scientist. Father's background is in pharmacy, then he was a scientist, and then went on to do other things, ending up as a cabinet minister in the Ministry of Health in Zambia. So I probably had no choice but to do something in health in general. But I did science first at King's and then went into medicine. When I came out of med school, I joined the regular army and was a medical officer for about 8 years or so. I did tours of Northern Ireland and Afghanistan as well. And then I left the army to kind of pursue a career path for me, but that the army were not effectively needing at that point. At the point that I left, they were looking for vascular surgeons and GPs. My particular career path with the military wasn't something they needed at that time. So it was fine. I left with very amicably, and it was all fine. I then accidentally ended up at St. Peter's as a locum doctor who just wouldn't go away. I was doing every shift going as an SHO, and then gradually did more shifts as a registrar. Just so worked out that I've kind of done effectively most of my formative training here at St. Peter's, and so it's a natural fit. Being here in that period of time, having come out of the army and then being able to be appointed into consultant posts and the medical education post has been almost a rite of passage, simply because I've been here for so long and I feel I should give something back, which would be appropriate, and this is one of the best ways I can do it. And of course, because of my military history, I've been able to take on the armed forces role, which I obviously would be very passionate about. And I've ended up back in the army as a reservist. So it's been absolutely wonderful sort of trajectory. When I look back, I'm so happy with how things have turned out, and I'm so happy to have been able to serve St. Peter's for all this time, but actually now be in roles that I can give back and help take us in a leadership direction.
Obviously, you can't see you because we're on a podcast, but I'm absolutely grinning away listening to that. And there's a bit that also makes me think, how varied that's been as well, because I doubt you had many senior adult people in the army that needed help. For those that don't know, senior adult medical services typically refers to what would have been known as geriatrics, but that's not really, the term that's used these days. So I find that really interesting. What made you go into senior adult medicine?
Hopefully he'll be listening to this at some point, but I blame Dr. Radcliffe Lisk and probably Dr. Keefi Young as well. When I was doing my registrar roles here, they influenced me and I just enjoyed them. But it's very interesting because I've been able to hybrid my role in working with older people as well as doing acute medicine as well. My current job plan allows me to do more front-facing medicine in the SDEC and on the CAU, and some of my work when I'm on call, it deals with acute medical presentations to the hospital. And then the other part of my job role is looking after patients who've got frailty and chronic conditions, dementia and delirium, and it's just quite a nice mix to the job role. And so very interestingly, I do get teased a lot by my colleagues in the army, joke about how I'm out of place and there's nobody with postural hypertension in the army and things like that. So it's wonderful, but it's also, I think, allowed me to have a balanced approach to my profession, because sometimes it can be overwhelming doing the same role at pace, whereas this breaks it all up a bit. And the older persons always bring me back down to earth, and they tell me what it's really all about and things, and stories about what they've done in their lives. And when we start talking about the military, especially, then you see them with their eyes lighting up, and they can tell you all these stories, and it's wonderful. And one of the patients found out that I was a captain. They immediately tried to get up off the bed and try to salute me. So I thought, it's fine. Please, Mr. So-so, just, it's okay. You don't have to do that. But it was really funny. And so that, it's a wonderful thing, really is.
People have said that variety is the spice of life. And it very much sounds like that variety brings you life. It's something that you really look forward to. You don't know what your day is going to hold. And I think what really resonates with me is just how important it is to connect with your patients. talking to you, it doesn't feel like a patient is a number or a health condition. You very much see the whole person and connect with them, and that's absolutely beautiful. You spoke a bit about the army into the NHS, or kind of falling into St. Peter's here. Can you share any moments in your career, your NHS one or even your army one, where you felt your racial or ethnic identity influenced your experience? And this can be positively or negatively.
Interestingly, and it's something that I've been kind of looking at, the more senior you get, you reflect on these things, and then you try to find a way of how you can make adjustments for the future for others. And with the British military as an example, it was an unusual thing to have black officers around, even when I was coming through, and even more unusually to have black officers with a profession. And I think that was quite apparent to me, because mainly I could see around that there were very few black officers that were of a senior rank to me. During my phase of training at Sandhurst and beyond that, there weren't many around. So you always, you were kind of aware you may well be somebody that others would look up to within a unit, particularly from Commonwealth countries. And so I was always trying to ensure that in the units I served in, that my voice was helpfully representative of the other Commonwealth soldiers that were in the unit. And so not just the black ones, but everybody else from around the world. But certainly for the black soldiers, there may be things culturally that they will express or feel during their work as junior ranks that may not be easily interpreted by the people they are being led by. And so I try to find a way of being that person. Difficulties I found for myself, and I want to be candid about this, a degree of suspicion is not quite the right word, but they just didn't know how to place me as an officer, as a doctor, and it was quite tricky for me to navigate that. I wasn't trying to prove myself, but at the same time, I felt the need to demonstrate that I had the credibility to be here and the validity as well. When I went to Afghanistan, that was all put aside. The unit I was with absolutely welcomed me. They treated me well, and there was no obvious issue around my race, but they just were not used to this. And so when they saw me in going on patrols with them and dealing with casualties and things like that, you're no longer the black doctor who's an officer, you're just the doc. And so you can see that and feel that. Of course, a lot of our colleagues in the military who are infantry have come from communities where there aren't many black people. And so when they come into the army and they say a black officer who's the doc, this is another level of thing that they're not used to, but they do get used to it. So that was very interesting. But I will say that climbing up the chain is something that I'm very interested in the military, and trying to be a representative at the top of the tree for others coming through. The army has some way to go in trying to make that playing field levels. They're trying, but it does feel sometimes that the top of the chain, it doesn't have quite the representation it needs to, even with well-qualified individuals. How does that look like with the NHS? These sort of historic organizations and bodies, that there is still some way to go. But I also flip it back. If there aren't people like me wanting and willing to step forwards, then I don't think it's going to be easy for organizations to do this. And so I do reverse the challenge back onto me's and others like me to get amongst it and help open the doors and the eyes of others to be able to achieve that. So that's the way I would sort of summarize that side of things for me. But it has been something that I've been very keen to share with people.
It sounds to me, in your talking, that you have been a really important figure and inspiration for many people in the army, in the NHS in particular, people who identify as black. It has got me wondering, what figures, past or present, have inspired you, to stand firm in your own power and pride?
That's a really good question, and thank you for asking that. So I sort of draw on a number of things. The first thing I will say, and this is the easy bit for me, and anyone who knows me will know this as a truism, is that simply my father, straight off the bat. He's not with us anymore, but he was that example, watching him, learning from him and everything he ever did. And then so I use that as my pillar. And then with that, there are other influences that I've looked at. And if we're talking about Black leaders, I've always been very interested in Nelson Mandela's life. Apart from his political intelligence and narrative and his ability to be so articulate in what he's describing, it was that ability to believe in a better future through his own suffering, if necessary. One of the speeches he made before he was sent to prison for life, I read it over and over again, but the last bit of it is that he's talking about how he wants the future of South Africa to be one where there's unity and integration and all the rest of it. And he just simply says, it is an ideal for which he is prepared to die. Now, that's just amazing. Now, of course, they chose not to give him that course, but put him in life imprisonment. But still, there he is with strength, fortitude, to get through something like that and still come out of the other end saying everything's cool and forgive everyone. Amazing. So that's really interesting. But then you look at people like Muhammad Ali, who uses sport to reach across the nations globally, and fundamentally isn't a politician, but has political values in his own character that at the beginning becomes offensive to others, but then he turns people around in the end to go, well, actually, what he was saying back then was completely spot on, and he's somebody who were actually attracted to his stance on things. So those are the two main ones for me, and I think they're fantastic. And then in latter day, I think Barack Obama did a fantastic job as a politician, but I think he re-established faith. I think that for people of color and the Black community, this is an achievable goal. And so he effectively, by his manner and the way he was able to inspire others to achieve what they would ordinarily have felt is unachievable. So those would be my, from the Black community for sure, those would be my top three.
Obviously, I mean, Nelson Mandela, Muhammad Ali, two very inspirational individuals. I'm really interested, though, in hearing a bit more about your father in regards to, any traditions, values, or stories that have been passed down through your family and that you hold close.
So there's and it comes down to education again. So my dad, at the time in colonial Africa, we're born into a royal tribe, and that's who we are as a family. But at that time, obviously, with subjugation, you were obviously under a governor or whatever. And my dad would go to a local school whilst he was tending the cows and things like that, and sit at the back of this class as a young kid, just watching what's going on, because at the time you couldn't enter primary school until you were 6 years old or something, and ridiculous. And so this headmaster would watch this kid sort of turn up regularly with his cows. What's he doing? And so he just basically thought, right, enter this class. And so he submitted the papers of all the class, and this kid who shouldn't be in this class, but he submitted the papers anyway, and he did really well. So out of the blue, the government at the time, the colonial government, had no choice but to put him through to secondary education at a time where they didn't want him to do. And he did so well. He progressed amazingly and actually got through primary school. His dad became really sick, my grandfather, at one point. So he came back from this amazing school, came to the village and said, Dad, look, you're dying, you're sick, I need to come back, I need to leave school and help you here. And my grandfather said to his son, my dad, if you don't go back to school right now, I will get off my deathbed and I will whip you, so you better get off. And it was just this idea that it doesn't matter. The values of education are the key. And also from that, by extension, is discipline and courage. You know, his own father is, you know, on his deathbed and he needs to get back. He's the boy, he's the son, he wants to come back and help out. But my granddad has it in himself to say, even if I am dying, you have to get back to school. You've got to continue this journey and you have to have the courage to do that. And so that, for me, I think made my father who he was in everything that he did. And like I said, he went all the way up to the top of Zambian government. But I learned that from him. And he talked about that a lot and similar sort of things. And so, again, that is in my locker. It's my go-to place when I think things are a bit tough or I just need something extra. Those are one of the things I go to.
It's such a beautiful story, and really powerful as well. And it sounds like your grandfather was really selfless and really encouraged you all. And look, you know, I can really see how your family have been such an incredible inspiration to you. And going back to you being an inspiration for others, what advice would you give to Black professionals just starting out in healthcare?
Yeah, I had a similar question asked to me in America, and I think I found it difficult to describe what that would look like at that time, and I've since reflected. I think that the first thing, and probably the easy thing to say, is see no color in yourself, in the sense that once you apply for something, once you're going for something, you are a person going for that role, going for that job. But your identity and who you are as a makeup of a personality, yes, then be proud of being Black and having that as your driving force, as it were, in everything you do in life. I really believe that it's everything is achievable. You can reach those ceilings and go beyond. It's a simple comment to say reach for the stars, but I really, really believe in that. And you know, when I talk to people, when I talk to schools, I used to be a mentor for Black kids in London, in Peckham, is to say, you know, why not? And that is it. Why not? Let's just go for it. And that would be the biggest thing I would say to anyone who's Black, aspiring for absolutely anything. Why not? And that's where I'd leave it.
100%. You don't ask, you don't get. And I think that's an amazing piece of advice. Just go for it. Thank you so much for your time today. It has been an absolute pleasure to connect with you. You know, not had much of a chance to cross paths and have a chat in our careers here. So it's been amazing. In this organisation, we have so many inspirational individuals, and these podcasts have really shown that. So I would like to thank everybody who joined us in our podcasts and who have shared their journeys, their heritage, who have and are inspirations for our Black colleagues. Thank you again to our listeners for listening, and we hope you found something incredibly powerful that you can take away from these podcasts.